If you've been experiencing dizziness, feeling off balance, along with neck pain or stiffness, you may have a neck condition called cervicogenic dizziness, and you should really save this post. I'm Dr. Alicia Carter, board-certified sports medicine physician, and I'm going to review the diagnosis, the theoretical causes, and the available treatments for cervicogenic dizziness. We all have special nerve endings in our cervical spine, which is the neck area, called proprioceptors. The proprioceptors are responsible for our sense of balance and position. They can be found in the discs in the cervical region, the muscles that overlie the cervical region, the joints, or the ligaments. When any of these structures become damaged by either trauma, poor posture, or arthritis, the proprioceptors can send abnormal signals to certain areas of the brain and trigger the dizziness. Listen to one of my patients describe her symptoms.
Symptoms were like before we met?
Well, I was experiencing a lot of dizziness that I wasn't really sure where it was coming from. I had had a very bad episode that had kind of pushed me over the edge. There were many times when I was walking and I felt like I was on a boat. And it's a specific kind of dizziness that Dr. Carter explained to me that is not because of inner ear.
Before accepting a diagnosis of cervicogenic dizziness, it's important that your doctor exclude more serious causes of dizziness, including a central nervous system disorder, cardiovascular disease, or vestibular conditions. There's no one single test that's considered the gold standard for cervicogenic dizziness, but an experienced spine physician can help make the diagnosis by getting a detailed history, doing a focused spine examination, and sometimes by doing diagnostic image-guided injections with an anesthetic. Treatment should start off conservatively and then advance to more sophisticated treatment options if necessary. Treatment options include physical therapy, therapeutic exercise, posture correction, anti-inflammatory medications, trigger point injections, and in some cases spinal injections. In my practice, if a patient has tried all these measures and still have symptoms, then I offer a non-surgical treatment option called PRP injections or platelet-rich plasma. That involves taking one's own blood, concentrating the platelets, which are rich in growth factors, and injecting the PRP into the target structures. I target the structures that I have identified with a high degree of certainty are responsible for the patient's symptoms. I combine that with the rehab program, lifestyle modifications, and the vast majority of patients do very well with this treatment approach. Let's hear what our patient has to say about her response.
It was a life changer. The procedure gave me hope, which is what I always say to Dr. Carter, thank you for giving me hope. And I've said that to her multiple times because I don't expect to be, in the body of a 20-year-old, but I do expect a quality of life, or I hope for a quality of life. So now I feel much more confident when I'm walking. The simple act of walking, just the psychological aspect of it was weighing on me, and so like I can walk and I feel pretty confident. I can be somewhere and not have something to hang on to. Dr. Carter is the best, and she let me know that there's hope.
So if you or someone you know is experiencing dizziness, feeling off balance with neck pain or stiffness, please give my office a call.